It is important to note that while this specific disability affects the processing of sounds, the larger concern is in the deficiencies in language acquisition, processing, and speech. DHH refers to those who are deaf and/or hard of hearing. Luft reports that IDEA services are designed to remediate achievement difficulties, yet they occur too late in a DHH child's development to exploit peak language learning capabilities. Reports of inadequate stimulation during the most active and receptive period can result in substantial lifelong language impoverishment, with coexisting deficiency in literacy skills and academic skills. Linguistic achievement is largely accomplished within the first 3 years of life. Research suggests that early detection is key in the identifying of hearing loss. Treatment plans are determined by a multidisciplinary team, which includes a physician, a nurse, audiologist, speech-language pathologist, and otolaryngologist. Students with hearing impairments have unique needs and abilities. As with all other disabilities, teachers should not make generalizations about students' needs without getting to know their unique learning styles. Two individuals with the same level of hearing loss may have very different needs and require very different supports. There are some important considerations that educators should consider. First, when hearing loss occurs, was it before the child learned to speak? These prelingually deaf individuals will have severe difficulty with communication and academic subjects taught in school. Children who lost hearing after learning to speak are postlingually deaf. Since these students have lost their hearing after learning to speak, they are typically able to communicate with others orally. Second, educators should ask, is there a coexisting cognitive impairment? Due to the many causes of deafness, it is estimated that 25% of children with hearing loss have additional disabilities. If this is the case, then additional adaptations will be necessary. It should be noted that the incidence of disabilities such as attention deficit disorder, visual impairment, learning disabilities, and developmental disabilities is higher in the deaf school-age population than in the general population. The primary areas of concern for students with hearing impairments are academic achievement and speech inability and language. Students with hearing impairments will struggle with academic achievement, especially in reading. The inability to communicate effectively, when we think of it as to understand and to be understood, inevitably affects learning in all other subject areas. The second concern is with speech ability and language itself. Teachers should model clear and effective communication in the classroom, and above all, they should use research-based strategies to ensure students with hearing impairments receive the highest quality of education possible.
Luff reports that the nature of students' hearing loss, regardless of the level, results in barriers that remain substantial as well as resistant to a multitude of attempted remedies. Furthermore, Luff reports that until they can consistently achieve language fluency by age 3, these students are likely to remain deficient in achievement and will struggle to attain adult success commensurate with their abilities and peers. New technologies have created opportunities for students with hearing impairments to have more access to the curriculum. Cochlear implants are the most notable of these, with approximately 15% of deaf and hard of hearing K-12 students benefiting from at least one implant. Technology for hearing aids has also improved greatly. Approximately 60% of students with hearing impairments use hearing aids for instruction, and 45% use a group assistive listening device in the classroom. So what specifically can we do to ensure this special student population is successful? Let's look at some strategies recommended by researchers and scholars in the field. First, as with any disability, the teacher should closely examine the student's IEP to familiarize himself with the student's specific needs and goals. Second, teachers should be familiar with and make an effort to incorporate deaf culture. Teachers should learn frequently use signs and advocate for students with hearing impairments. Third, teachers should frequently check for understanding using strategies such as multiple opportunities to respond, or OTR. Fourth, a sign language interpreter who participates in the life of the classroom is an essential part of an inclusive classroom. Typically, this would be mandated by a student's IEP. Along these lines, teachers can also work on reducing background noise in the classroom by ensuring fans, air conditioning, and lights are working properly. Last, it is important to establish visually rich learning environments. Consider incorporating visual aids as often as possible to support lectures, oral instructions, classroom management, and daily schedules and routines. Students with hearing impairments are eligible for accommodations under IDEA or Section 504 as mandated by their IEP. Educators should carefully analyze the purpose of an assessment to identify what components should be modified, either only the instructions if assessing reading comprehension or the entire test if evaluating content knowledge, for example, a math test. Scholars in the field recommend the use of curriculum-based assessments such as checklists, tallies, assessment rubrics, artifacts from a portfolio, interviews, and analysis of language samples as authentic assessments of learning.